Hi, my name is Delverine West Aarons, and this video is my first self reflection for my pediatric clinical rotation. I have been a pediatric nurse for several years. I've been a nurse for over 20 years, and I've worked in several different areas of nursing, but I usually come back to pediatrics. And so for the past 17 years, I've been working in pediatrics. I have a background of working in the hospital setting, NICU and PICU and PEDS in the hospital, but I usually come back to home care nursing. And the reason that I do home care PEDS is just that you can be there to see the outcomes of these patients. The patients that I take care of in the home setting are usually technology dependent. They're the children that come out of the NICU and they go home with a ventilator, they have a trach, they have G tubes, and lots of monitoring and skilled nursing happening in the home setting. So I have a residential service agency licensed by the state of Maryland, and we provide nursing care for children on REM, straight Medicaid, and model waiver programs. And we do send skilled nursing out to take care of these patients. As far as the reason for me doing this program, it's that when I work in pediatric home care, I see a lot of disparities among the recipients of healthcare. There are those who have a lot, and there are those who do not have what they need to satisfy their needs as far as healthcare. And so I thought I could help in this regard. I also am very concerned about the patients who have to carry so much equipment with them when they go out for a doctor's appointment or a, um, a hospital visit. They have to carry a ventilator, they have a suction machine, they have a pulse oximeter, they have an oxygen tank. Some of these families don't even have transportation, so they're taking these things on a public transportation, and it's very difficult for them. I thought that if I could be a nurse practitioner and be able to make home visits, the pediatrician that I'm going to be doing my clinical rotation with was actually a pediatrician who, at the time, years ago, he did home visits. He would come out to see the patients. And I got that idea actually from his practice. And I thought that it would be very helpful to these families if I could do that, if I could go out and do these evaluations and assessment for these patients so that they don't have to go through what they do go through to just make an appointment. Also, to be a better advocate for these patients. If I am educated as far as what their needs are, as far as medical needs, I'm better able to advocate for them. And this is also one of the reasons why I'm in this program. For my future plans, this is what I intend to do is to maintain children in a home care setting and be a strong advocate for them. From the clinical practice, my clinical rotation, I would like to make the transition from being a nurse to a provider. It's a different setting, it's a different mindset, and this is what I know I'm going to be struggling with a lot because as being a nurse for this many years and then being a provider, it's a different protocol, it's a different situation, and this is what I'm looking forward to achieving. I have seen many different diagnoses and deal with many different clients, but I pretty much think that I have so much more to learn, and I'm looking forward to expanding my knowledge and building my confidence in this situation, being a provider. And those are my goals. So, pretty much, that is what I want to do. I enjoy working with the peds. I don't think I want to work in any other area of nursing. I get a lot of satisfaction from seeing a child who was born 1,100 grams and are now able to walk and talk and be decannulated. And that is really satisfying to me and it's fulfilling. And so therefore I'm a ped nurse for life. Thank you.